I'll just briefly take you through our agenda first off. You've heard Pascal speaking. I'm going to give you and share with you some short insights into migraine in the workplace as it relates to Ireland. Then Olivia will come on board by 2:10 or 9:10 American time, because she's there, to speak about the prevalence, the economic impact, personal impact, and how organisations can help those with migraine. Then we'll have a presentation from Dr. David Dodick about the Migraine Fitness at Work programme. And then hopefully we should have 10 or 15 minutes Q&A towards the end. So migraine at work. Pascal alluded to it there, that there are an estimated 600,000 people who live with migraine, and many of these also work. It's believed that between 12 and 15% of any given population have migraine. And to put this in context, if you work in an organisation of, say, 100, or rather 1,000 people, somewhere between 120 and 150 of your colleagues will have migraine. Migraine is responsible for over 500,000 working days lost each year in Ireland. And to compare that, in the UK, up to 25 million days are lost from work each year because of migraine. In Ireland, on any given day, there are 13,000 migraine attacks. In the UK, this figure is believed to be 190,000 attacks daily. Migraine, unfortunately, is most troublesome for people during their most productive years, and that would be when they're in education and as they move on to work. In terms of costs, it costs the Irish economy on average of 252 million per annum. And that is in the context of lost work and lost productivity. Your average migrainer takes 2 sick days per year and potentially loses another 4 in reduced productivity. That could be where they're experiencing a migraine attack and they really should have an out of order sign on them, but they're trying their best to work. For those with severe migraine, it is estimated that the unemployment rate is 4 to 5 times greater than the average rate. Now, over the summer of 2021, so last summer, the Migraine Association, we distributed a migraine in the workplace survey through our various different social media channels, including LinkedIn, Facebook, Instagram, and Twitter. And what we were trying to find out is how migraine affects people's work, their careers, and their professional life. We had a great response to the survey, and over 400 people took part in the survey. And I suppose the resounding conclusions coming from the survey is that many people with migraine stated that their illness did indeed interfere with their work. And while others felt that their employers unfortunately didn't provide enough support for their condition. People with migraine are often hiding in plain sight at work. Migraine is an invisible illness, despite it being the 3rd most common disease in the world. Employers or fellow colleagues will often have no idea that an employee or co-worker is in pain with their migraine. In fact, employees with migraine, they're often conditioned to hide their attacks out of fear of, I suppose, criticism, discrimination, demotion, or in fact, lost opportunities. I'm going to share with you some of the key findings from our workplace survey. So the good news and the promising news is that of the 400 people that we surveyed, 84% of them have actually spoken about their migraine at work. This, as I said, is a figure much higher than we would have thought. And what it means is that, for the most part, people are open about their condition. Unfortunately, however, only 51% of migraineurs don't, or rather, 51% of migraineurs don't feel supported if they experience a migraine attack while working. What they overwhelmingly feel is that there's a lack of understanding of migraine by colleagues, with some saying that their colleagues think it's just a headache, take 2 paracetamol and you'll be absolutely fine, when in truth, it's anything but that. I guess other respondents would have said that their work colleagues just don't realise how debilitating migraine can be. And other commentary in the survey would have said that while immediate colleagues would have been supportive, oftentimes it's management who are less supportive. In terms of accommodations, 74% of respondents stated that their employer had no supports or accommodations in place. Many employers likely have concerns that accommodations would cost too much money, but the reality is that workplace accommodations aren't all that expensive. For example, a nearly universal migraine trigger is bright lights, and these would include, for example, fluorescents or headlights or computer screens. And some of the suggested accommodations could be to add these fluorescent light filters into your existing fluorescent lights to create a more natural lighting environment, or for computer screens to provide anti-glare filters, which can often help reduce the amount of light coming from those screens. And a very simple move, and one that we've heard of when we've given our talks, is simply to move an employee to an area where they can make their own lighting adjustments. So out of directly underneath a fluorescent light, and maybe to somewhere that they have natural lighting coming in from the outside, or indeed at their own desk lamp. So a whopping 82% of respondents reported that migraine had directly impacted their professional lives. Many say that their condition has impacted on their ability to perform their role or carry out their job to the full extent that they would like to do. For some of them, it affects their confidence, which adds to their stress, which impacts their clarity of thoughts, can affect their time management, and I suppose ultimately causes anxiety and can make a day very, very difficult, especially when they're experiencing a migraine attack. For many others, it's actually had an impact on their promotional prospects and their career choices. It may be that, if they apply for a role, or they think they might like to apply for a role where travel is involved and travel plays havoc with their migraine, then they make the choice not to apply for that particular job. We know from the work that we do day in, day out, and the talks that we give, is that others have had to change their career or only work part-time as a result of their migraine. And for many, unfortunately, their migraine affects their sick leave record. So where do we get to? We know that employees with migraine, they have an overwhelming desire for their colleagues and employers to be more understanding and more aware about what migraine actually is. 85% wish that their colleagues would understand that migraine is not just a headache, but a much more debilitating illness. A further 11%, they wish for time out or the option to go to a dark room, for example, and other additional supports that could be flexibility or more flexible working arrangements, while 4% would welcome changes in their work environment so that the workplace itself would be less triggering. So that's where we are for our survey. I have two colleagues here who are going to share other aspects of migraine with you. First up is Dr. Olivia Bagast-Dahim, and Olivia will share insights on the prevalence of migraine and the economic impact on companies, personal impact for employees, reasons why migraine is so disabling, and some evidence-based ways to decrease migraine-related productivity loss. And just by way of background, Dr. Olivia is a board-certified neurologist and headache specialist involved in advocacy, especially to support people with headache disorders in the workplace. Olivia has given national and international talks and wrote several publications on the topic, including one in the Harvard Business Review. Olivia is a member of the Executive Committee of the International Headache Society's Global Patient Advocacy Coalition and of the American Headache Society's Advocacy Committee. Olivia is co-author of an upcoming book that provides practical and concise advice, headache evaluation and management, which will be published by Oxford University Press in January 2023. Over to you, Olivia.
Thank you so much, Linda. Good morning, good afternoon, everyone. I think we can add my last name to Pascal's list of challenging last name to say. I'm happy to be here with you today to continue talking about migraine in the workplace. Before we dig into the topic, I've heard from employers telling me, oh no, we don't want to talk about it. We don't want to encourage it. There's absolutely nothing to encourage. migraine is it's a disabling disease. Talking about it can actually help. So just want to get that out there. So what is migraine? It's a genetic neurological disease with many different symptoms. There's a throbbing pain, but people can have difficulty thinking, concentrating, vision changes, difficulty speaking, dizziness, vertigo, nausea, vomiting, cramps. The symptoms are very wide. The attacks can be very unpredictable. It's very common. It affects 1 in 5 women and 1 in 16 men. It affects about 600,000 people in Ireland. And according to the global burden of disease, it's the second leading cause of disability in the world. So we'll discuss the impact on employers, on employee, why is it so disabling, and then 3 evidence-based ways to help with migraine-related productivity loss, which are education, management program, and creating a migraine-friendly work environment. So impact on employers, main objective saying is costs, and Linda alluded to it, but it's estimated to be $13 billion in the US, 27 billion euros in the European Union. Migraine is thought to represent 16% of total US workforce presenteeism, and presenteeism is coming to work with a disease such as migraine, so you cannot be as productive as you normally would because of the symptoms of the disease. In a more recent study at Fujitsu, it was estimated to cost 350 million for 150,000 employees. And it's hard to measure, it's hard for employers and companies to notice because 18.9%, so most of it is due to presenteeism. A study estimated that people with migraine are about 46% effective during a migraine attack. The higher the headache frequency, the more absences, but also the more days work with decreased productivity. And the fact that most of it is due to presenteeism is another marker that people with migraine, they really want to work. So the impact on employees, and Linda went over the Migraine Association of Ireland survey, and it's good to have survey data to corroborate what we see in clinical practice. I always like to ask my patient, if you didn't have migraine, how would your life be different? And there can be such a discrepancy between what people aim to do or study they wanted to do as a career and what they end up doing because they had to adapt to the severity of the disease. And even when the disease is controlled, sometimes it's really hard to go back to your original field. But in the Migraine Association of Ireland survey, 22% had to change the career. As Linda mentioned, it affects time management, especially because migraine attacks are so unpredictable. Migraine itself affects your clarity of thought. There's a lot of difficulty concentrating, thinking, paying attention with migraine attack that can linger after and start before the headache pain, because it affects professional career and development. It can affect financial status. There's a lot of guilt about not being able to perform as well as you can. There's not enough understanding, and that can impair work relationship. Also, a lot of stigma. Someone was kind enough to send a question before this talk about return to work, and it's really hard to answer that question because it depends on someone individual migraine type and attack and length of attack and length of the lingering phase with the symptoms. It depends on your job function. It depends on how supportive your work environment is. So there's no specific rule, but as a general rule, you have to make sure, first of all, it's safe for you to get to and from work. Like if you have very severe vertigo or vision changes, like you cannot drive, for example, or take the bus safely. Can you perform some of your job functions with or without accommodations? Can your boss be supportive and provide some accommodations for you to be able to return to work? In the fitness to work community and the fit to work note, at least as in the UK, you don't need to be back to 100% to be able to work, as long as you can perform some job function and have some accommodation. So why is it so disabling? There is a pain. When people with migraine were asked to rank the migraine symptoms based on disability level, pain was the first one. But the close second was cognitive dysfunction, difficulty with thinking, concentrating, paying attention, followed by sensitivity to light and to sound, and then followed by nausea and vomiting. It's very unpredictable. So people with migraine need to plan work tasks in advance in case a migraine attack comes before a big deadline, for example. There are conditions, there's other diseases that are more common in people with migraines that independently decrease productivity at work too, such as sleep disturbances, insomnia, depression. And it's crazy to have to say that in 2022, but migraine is still very underdiagnosed, including 1/4 of people who consulted a healthcare provider for headache are not getting diagnosed with migraine. And this underdiagnosis obviously leads to undermanagement, because a lot of things we can do and that we can increasingly do to make things better. And then pervasive stigma. Stigma is everywhere, from colleagues, friends, family, healthcare providers, media, or language. How migraine is represented in images, and that leads to discrimination, loss of status, relationship, prejudice. It can be internalized too, because it's all around us, and it leads to anxiety, fear, guilt, shame. Its internalized stigma is actually associated with increased presenteeism and decreased pay. In a great study by Dr. Shapiro, with using a US sample, like a representative sample of people in the US of about 2,000 respondents, about a third said that they think that migraine is easily treated, caused by unhealthy behaviors, use an excuse to get out of commitment, and it is faked or exaggerated. So still a long way in raising awareness, which leads to the first thing we can do to help people with, and help everybody actually regarding the topic of migraine in the workplace, is migraine education program. And 3 main goals: to raise awareness, increase understanding, second, to increase diagnosis and management and optimize management for those already diagnosed, and decrease stigma. And there have been studies that show that migraine education program in the workplace increase productivity by 29 to 36%. And that's by cutting absences, decreasing the number of days worked with a migraine attack, and increasing productivity when working with a migraine attack. So there are different ways that migraine education program happened in those studies. Dr. Dodek and Heather are going to go over the International Headache Society Global Patient Advocacy Coalition Migraine Fitness at Work program. In those studies, people did online modules with pre and post questions, webinars, lectures, newsletters, info booths in public spaces, brochures, and education at Wellbeing fairs. The second evidence-based way to help is a migraine management program in the workplace, so help with the treatment and management part. And these programs have actually combined the education and then screening and management, but they've been shown to increase productivity by cutting absences by about half and increasing productivity at work during a migraine attack. In the Spanish Postal Service study, it actually cut migraine-related productivity loss costs by 90%. And the study at Novartis, they found a 5 times positive return on investment for the migraine education and management program. So how do this migraine management program usually work? So there's company-wide education and then a voluntary anonymous evaluation, which can be by survey, by teleneurology, virtual visit, by visits to the occupational health service for larger companies or employee health for healthcare systems, and then optional management program and either occupational health helping with the management or referral to an outside clinic or a specialist on individualized coaching with smartphone apps or a nurse calling line. So there was such a project in collaboration with the International Headache Society Global Patient Advocacy Coalition and Fujitsu, where they did online module that was attended by more than 70,000 employees, with great majority of employees thinking this was very useful or useful, and about 2/3 of people who said they would change their attitude towards colleagues with migraine. And then based on needs, they could consult with a headache specialist to get care. They also offered patient groups and headache exercises, and they tried to make the work environment more migraine friendly. The study at Novartis, so they did education via newsletters, booths, emails, and then there were teleneurology evaluation for those interested, and then they were referred back to neurologists for the management, and they also offered smartphone-based coaching. That costed about $1,000 per participant and was found to have a 5-time positive return on investment by increasing number of work days by 10.8 work days per year. Migraine-friendly work environment, and I'm glad Linda mentioned all the lights. I have less to mention, but actually in the studies a lot was about autonomy and social support and having increased understanding by colleagues. Job satisfaction is a big one, good atmosphere, reduce unnecessary stress as much as possible. Some stress obviously can be reduced. An interesting study was actually one in Serbia with increased headache frequency and severity for employees who had to interact with more than 10 colleagues in a day. So try to reduce how much people interaction, limit shift work, flexible hours. Linda mentioned some of the work environment adaptation. So light, sun-free area, decrease the noise, ergonomic setup, and if possible, work from home for those that they find working from home helpful. So in summary, migraine is a disabling neurological disease. Most of the migraine-related productivity loss is due to presenteeism. So it's hard to measure. We also show that, people with migraine want to work. And there are ways to help by increasing understanding, raising awareness, increasing support, breaking the stigma, optimizing diagnosis and treatment, and creating migraine-friendly work environment.
Thank you, Olivia. Next up, we have Dr. David Dudig, and David will share details of the recently launched Migraine Fitness at Work program. And this has been designed by migraine experts and patient advocates. And the program aims to reduce migraine stigma and create more accessible workplaces. Some background on David: he is emeritus professor of neurology. He's a Mayo Clinic distinguished investigator and distinguished educator. Dr. Dudig founded and directed a headache and concussion program at the Mayo Clinic. He's authored more than 900 peer-reviewed manuscripts and abstracts and authored and edited 13 books. He's Chief Science Officer and co-chair of the Actuaria Academy of Science and Medicine. He is chair of the American Brain Foundation and chair of the International Headaches Society Global Patient Advocacy Coalition. He's immediate past chair of the American Migraine Foundation. He is former editor-in-chief of Cephalalgia, a past president of the American Headache Society, and a past president of the International Headache Society. David, you're very welcome, and we look forward to hearing from you.
Thank you, Linda. Good afternoon, everyone. Thank you very much for being here today. We appreciate your time and the interest. And I want to thank Linda and Pascal as well from the Migraine Association of Ireland for convening you all together today for this presentation. You know, the Migraine Association of Ireland is an absolute powerhouse when it comes to supporting people with migraine. And really, they're the North Star and sort of a gold standard, which I think most other countries around the world could and should want to emulate. So congratulations on the work that they've done. Because of what you've heard from Olivia, we at the International Headache Society back in 2017 decided to bring people together in Vancouver at the International Headache Congress. And when I say people, I mean people from over 50 different organizations, from the World Health Organization to leading neurological societies like the World Federation of Neurology, to regulatory agencies that approve drugs like Health Canada, EMA, FDA, leading headache societies, leading patient advocacy groups, and patient advocates themselves. So we brought these organizations together in Vancouver at a summit that we called the Global Patient Advocacy Summit, just to get the lay of the land and to assess the landscape of what's being done to support patients globally who have migraine. Since over 1 billion people on the planet have migraine, we felt that something needed to be done for these people around the world to advocate for them, whether it's advocating for public policy changes, research, support in the workplace, and what have you. So you can see the picture there of the group that came together. And what came out of that meeting was the need for a Global Patient Advocacy Coalition, or GPAC as we call it. And GPAC really is a convergence of representatives from many of these organizations that I talked about. And the idea was that through GPAC, we wanted to create a world in which migraine was optimally understood and optimally managed, not just to raise awareness that migraine is disabling, but really get people to understand why and how disabling it is, and how, given the plethora of treatment options available to patients, how we can actually manage this disease quite effectively for the vast majority of people. So we wanted to put together, these were the objectives of the Advocacy Coalition. One is to reduce stigma, and in particular, reduce stigma associated with migraine in the workplace. We had met with the World Health Organization, and we talked to them about where we should actually start. And their recommendation was that we start in the workplace. Why? Well, because most people who are affected by migraine are working adults. There are people between the ages of 18 and 55 who are in the workplace, who are trying to, build a career, get an education. So that's where we decided to focus our efforts. And we realized that given everything that Olivia just told you, we needed to reduce stigma and create a world where migraine is optimally understood. The second thing we needed to do was to educate and empower employees who have migraine to seek treatment to improve their ability to function, their productivity, and their overall well-being. Because we know that people suffer in silence. They feel intimidated because they felt marginalized and ostracized from the medical community. And for those 50% who actually do seek care, as Olivia said, many of them, unfortunately, don't receive a diagnosis. And even if they do receive a diagnosis, they're not properly managed. So we wanted to educate and empower employees how to enhance their own self-care, the things that they can do for themselves, as well as provide them with the information that they needed to be able to talk to their provider, their clinician, because there's a plethora of treatments available. And so we wanted to educate them around everything that can be done. And then we wanted to talk to employers or managers about how to set up a workplace-friendly environment for people who do have migraine. It doesn't take very much, and some simple things can really go a long way. So we started in Vancouver in 2017. We actually published a blueprint for patient advocacy that in 2018. We then met again in Dublin, actually, in 2019, just before the pandemic, to assess how far we've come and where we need to go, and actually published the proceedings of that meeting as well. Prior to that, we met in New York City, and we decided, based on our conversations with the World Health Organization, that this GPAC, this coalition, would start to advocate for people with migraine in the workplace. And it so happened that we did a study with Fujitsu. When I say we, I mean the International Headache Society, the World Health Organization, actually did an epidemiological study in Fujitsu. There are more than 175,000 employees. And I can tell you the top line results from that was that 17%, or more than 25,000 employees, had migraine. 3% had migraine almost every day. And the productivity loss for the employees as well as the employers were substantial. As Olivia mentioned to you, it was upwards of at least 200 million and upwards of $350 million per year, US dollars per year, that it cost Fujitsu in lost productivity. So we co-created, this coalition co-created with Fujitsu an employer solution and employee program. So we deployed the program within Fujitsu. And just to make a long story short, we talked about the cost. 90% of the employees said the program was beneficial. Almost 3/4 of employees now understand that headache is a disease, migraine is a disease that greatly interferes with one's ability to function in one's daily life. And that was up from about 20% before completing the program. So I think we created a world within Fujitsu where migraine was optimally understood. Maybe not optimally, it would be great to be at 100%, but we certainly made tremendous gains. And then, as you heard, 76% of employees said it had changed the way they treat colleagues with headache and with migraine, is likely to change after completing the program. So in terms of reducing stigma, one of the other objectives of this entire initiative, I think we've accomplished a great deal. And soon we'll have results on what it actually meant for the productivity of the employee and what it actually meant for the cost savings for the employer. So we'll have those results available soon. So we created this Migraine Fitness at Work program. And why did we call it Fitness at Work? Because a lot of programs in the health sector are wellness programs. So we called it a fitness program because if you look up at the definition of fitness, it's one's ability to execute daily activities with optimal performance and endurance with the appropriate management of disease, fatigue, and stress. So this is really a fitness program that we hope will optimize people's ability to perform and function at work and also away from work. So it's a video-based educational program that can be customized to the employer to ensure that those with migraine are supported and those with migraine understood all that can be done and those with migraine seek care when needed. Also, again, to reduce stigma amongst those who don't have migraine. So I can tell you in Fujitsu, can you imagine 75,000 employees at Fujitsu just in Tokyo, in Japan, and over 90% of the employee base, those with migraine and those without migraine, participated in this program. So there was incredible alignment and adherence and compliance in completing the program. This program is self-paced and online, so people can complete it within an hour if they so choose to go through all 3 modules, or they can self-pace and they can complete 5 to 10 minutes here, 5 to 10 minutes there, and so on. There are quizzes before and after each module so that we can be sure that this program is actually effective and it really is increasing knowledge, reducing stigma, and empowering people to take control of their own illness. The goals of the program are to obviously collaborate with employers, educate the workforce, to reduce stigma, and provide the resources that people with migraine need to empower self-efficacy, as I talked about, and reduce the burden of their illness, both at work as well as away from work. What I think is unique about this program is that it was developed by experts, and these are just some of the experts that sit on the executive committee of this GPAC coalition, but they're also experts from around the world, from all corners of the world, who co-created and who participated in this. So one can be confident that the information there has been vetted and is up to date and is the standard of care from the experts who curated this content and developed the program. As importantly, if not more importantly, it was co-created by patients from around the world. And I'm sure many of you may be familiar with Audrey Craven at the Migraine Association of Ireland. She was also president of the European Migraine Headache Alliance, and she is a true global leader and patient advocate in this space. She happens to sit on our executive committee as well, but there were patients from all over the world who really provided very important insight and feedback on this program. So the program, as I said, it's online. It's 3 modules, pre and post module quizzes to be sure that we're actually accomplishing what we set out. For companies who deploy this, they can we can co-create with them. They can add their logo. We can customize it and in different languages. So thanks very much for your attention, and happy to address any questions you might have.